Etiologic spectrum and prognosis in noncompressive acute transverse myelopathies. Introduction. We evaluated the spectrum of acquired demyelinating and inflammatory disorders in patients presenting with an acute transverse myelopathy. We also studied differences between an acute idiopathic transverse myelitis and myelitis resulting from other etiologies. Materials and methods. 80 consecutive patients with acute transverse myelopathy were included. At inclusion, clinical profile, serum and cerebrospinal fluid parameters, brain and spinal cord magnetic resonance imaging, and visual evoked potentials were obtained. All patients were given methylprednisolone therapy. Patients were followed up for 6 months. Outcome was assessed using modified Barthel index. A modified Barthel index score of less than or equal to 12 indicated a poor prognosis. Results: majority, N equals 49, 61.25%, of patients had idiopathic acute transverse myelitis. 11 cases had neuromyelitis optica spectrum disorders, 8 had anti-aquaporin antibody positivity. Multiple sclerosis was diagnosed in 7 cases. 8 cases had infectious or peri-infectious myelitis. Longitudinally extensive transverse myelitis was noted in 66, 82.5%, patients. 17 patients had abnormalities in the brain. Majority of patients improved following methylprednisolone therapy. On univariate analysis, delay in administering methylprednisolone therapy, poor modified Barthel index at discharge, and extensive cord involvement were associated with severe residual disability. On multivariate analysis, delayed initiation of methylprednisolone was identified as a poor prognostic factor. Conclusion: a variety of inflammatory, infective, demyelinating, and autoimmune disorders present with acute transverse myelopathy. Early institution of methylprednisolone reduces the disability in these patients.